There are 4.8 million apps available for download, but few of them actually save lives like the one that Colorado recently rolled out to its citizens. Colorado has joined a handful of states in the United States that have developed a COVID exposure app. The app, which has already been adopted by 20% of Coloradans, uses an anonymous string of numbers to decipher if someone has been exposed to COVID-19 due to proximity of their phone to someone else's phone who has tested positive. We spoke with Brian Devine, who is currently the Deputy Incident Commander for the COVID-19 response with San Juan Basin Public Health, about how the app works and the many benefits it provides to public health.
The app is the Colorado Exposure Notifications app, and the purpose is to complement our public health investigation efforts by giving another route to notify people that they may have been exposed to COVID-19. We do a case investigation every time somebody tests positive for COVID-19. And one of the things we ask them is who their close contacts are, so we know who they may have exposed. And of course, we then want to quarantine those people. But of course, not everybody knows the names of all of their close contacts. They might not know the names of everybody they work with, or people they were at an event with, or friends of friends, or things like that, or just people that they happen to come into close contact with that they don't really think about during our interview. So what the app does is allows us to try to identify some of those people as well, because your phone knows what, or can know, your phone can know, if you have this app, what other phones it's been in contact with. And that allows us to get a hold of more people that you may have exposed and get them to quarantine as well. So if we can use this app widely in the community, then we can limit the spread of COVID-19. We can identify more people's contacts and get people quarantined who might otherwise be missed.
The app only works if both you and the person who tested positive for COVID-19 has the app on their phones and is activated at the time of exposure. Another benefit of the app is that when you get notified of any exposure, you will receive specific instructions on what to do next, which is most likely to get tested and quarantine. The app is designed to notify you of an exposure if you are within 6 feet proximity for at least 15 minutes of someone who has COVID-19.
You get a notification if the app automatically identifies your app as a close contact, essentially. A notification will pop up. It will tell you the date that you were believed exposed, and therefore it will give you instructions on how to quarantine. We quarantine for 14 days after exposure. And it will tell you when it will recommend you to get tested. And that's also based on the date of exposure. So it automates a lot of that information that we need to get out to the community and gives you some peace of mind that, yes, you may have been exposed, but don't worry, there's testing available. Here's when you should get tested and how. And here's how long you might need to quarantine.
Devine also explained how the app is completely anonymous and does not store any identifying information like your name, location, or phone number.
It's really important that people feel comfortable using this app because, again, the more people that use it, the more effective it will be. As I understand it, the app exchanges basically an anonymous string, a randomized string of letters and numbers with the phones around it. And it does so when it's within 6 feet of another phone for 15 minutes. That's the same definition of close contact that we use in our traditional investigations. So it's designed not to just pick up every phone that you were in contact with, but really identify close contacts. It does all this just by exchanging strings of letters and numbers. So it never uses your name, it never uses your phone number, and it does not record the location that that interaction took place. So it's doing this all just over Bluetooth. Without using GPS or without using any other features of your phone. Then when we do a case investigation after somebody tests positive, we ask them, do you have the Colorado Exposure Notifications app on your phone? If they say yes, we give a code to them to input into the app on their phone that includes the dates that they were considered infectious based on when they developed symptoms and when they tested positive. The system then automatically takes that information, identifies the phones that it was a close contact of only within that period. So it even throws out all the phones that it was in contact before or after that period. And it sends a notification directly to that phone, again, without using anybody's name or phone number or location.
Given that the last pandemic in the United States ended in 1920, we were curious how the use of other types of technology are helping public health agencies manage the current pandemic.
It's a long list. You're right to point out that since the last truly global pandemic, things have come a long way. You know, that was 100 years ago. We have electronic lab reporting now. So as soon as a laboratory result registers as positive, notifications go out. We are able to call people on a cell phone. We're able to text with people. We're able to email them quarantine instructions. We're able to do mass texting for exposure notifications. That's another thing that we're doing locally. We have so many people that we need to notify because people now have about 10 contacts when they get identified as a case on average. That's a lot of people that we need to contact. So we've been able to automate a lot of that as well. The other thing that's really different with this pandemic, even from if this had happened maybe 20 or 30 years ago, is data analysis. We have data stored in places where we can do all kinds of computerized automated data analysis on it. The field of epidemiology has advanced a lot in a couple of decades just by doing computerized data analysis. So we're able to take the information that we gather from testing and from case investigation and actually try to draw some conclusions for what's most risky in our state, what kind of activities present the highest risk of transmission, what is it safe to do, what is it not safe to do, how quick are tests coming back, do we need to provide more testing, do we need to take testing to certain industries that are seeing high usage. There's all kinds of data analysis that we can do.
Since we were already interviewing Devine, we couldn't help but ask about vaccines and when to expect doses to reach our community.
The year of 2021 is going to be a year of vaccination, and it's probably going to evolve such that, you know, what we're doing this month is not the same as what we're doing to vaccinate people over the summer. But it's certainly good news, and we're looking forward to protecting our most vulnerable community members this winter with an approved vaccine.
To download the app, visit the Apple App or Google Play stores. For more information about the app from the state of Colorado, you can visit covid19.colorado.gov/exposure-notification. Stay tuned for a future story about vaccines in our community. Thank you for watching this edition of Pagosa Local News.